get this thing sorted. Good evening. Welcome to day 4. Whew, I feel like a superhero. We are on day 4 of our 5 days of live training, and we've been going through different parts of the UK qualification process. So, how many of you are just like gaining? You're growing. How many of you are pretty excited for the journey right ahead of you? I hope that, before you started attending these trainings on Monday, maybe you were feeling overwhelmed, not sure of what to do, how to do things. But as we're going through the teachings, hopefully you're beginning to gain clarity. And if that's you, I want you to put clarity in the comments below. I tell you that if I were there back in the day when I was doing my thing, oh my God, that is just like. So I want to believe that when it comes to preparing for your interview, the way you're structuring your questions, you're beginning to have a feel. And even those of you that are not actively going through the process, maybe because you haven't yet gotten the required prerequisites, but you're listening, you're following closely, and definitely getting yourself ready for that particular time when it will be you. All right. So once you come on, whether you're watching live or on the replay, I'd like you to put in the comments below #live, #replay. Secondly, I'd like to know your name and where you're calling from. And please be kind enough to let me know where you are in your journey. Today's live is particularly for those that haven't sat the GOC interview. But what we'll be discussing tomorrow, all things money, all things visas, all things jobs, then that cuts across all spectrums. But today it's particular to today's stream is particular to all those who it's particular to all those who haven't sat the GOC interview. Would you be kind enough to share for me? Go ahead and share the stream on your platforms, your optometry platforms. Let someone know that we are live, and you never know what story you can change when you are generous enough to share the live. Hello. For those of you that don't know me, my name is Dr. Desi Cosmos. I am the CEO of ACN Academy, among other things, wife, mama 4, lover of Jesus, life coach, you name it. Yeah. But today I'm putting on my ACN Academy hat, where I help international optometrists from whichever country, as far as you qualified outside the United Kingdom and Switzerland. Yes, I'm that voice saying, this is the road you should walk therein. He who has ears, let him hear what the messenger of UK qualification is saying. All right. So I want to know, who's here. Thank you so much for coming in. If you have any questions, just go ahead and put it in the comments below. It's also nice. I like to know whether you're watching on YouTube, Facebook or LinkedIn. It's good for me to know where my audience are coming from. And I'd like to know whether you join me in the afternoon on TikTok. And if you have been joining the learning since Monday, would you be kind enough, be generous enough to put in the comments below what you have learned so far? All right. Amazing. So we're just going to get started right now. I can see some people are here. Thank you for the response. Okay. Thank you. Awesome. Thank you, Ma. Thank you. Have you got anything out of the learning? I know you've been on one or two or maybe three of them and you've watched the replay. If there's anything you are learning or you've learned, could you kindly put it in the comments below? And if you have any questions, go ahead and ask. Okay, right. I can see that I didn't do my makeup today, but that's fine. Absolutely fine. All you need is my voice. Just keep speaking, girl. That's all you need. All right. So let's go. I remember back in the day, this would have been 2014, when I was looking at my logbook, thinking about my logbook, thinking about all the patients that I had seen in Nigeria. I remember making a phone call to my in well, then she had become an optom, but the intern that I worked with at the time in New Era Hospital, Aba, Abia State, Nigeria, I remember calling her to say, you know what, I really want to go through this UK qualification thing. Do you mind sending me just, I don't know, did she even, like, this is a joke. In 2014, I asked her to send me, you know, when they talk about evidence, like just send me the patient records. Did she sent it physically? Yeah, I've discarded of all of them. And then I had to pay for Waybill for them to send me all the records. Come on, girl. Why didn't I even think that she could scan it? And when I got all these records, I was looking at it and I'm thinking, my goodness, making me, how do I make sense? How do I fit in? Because in the logbook at the time, there were different um sections in the logbook. I'm actually going to, I didn't think of this before now, but I'm actually going to go into my email and see if I can find my logbook. And I'm just gonna, let me see if I can find it, logbook. I'm just gonna see whether, you know, the email saves a lot of things. Logbook, IP logbook, no, that's for my independent prescribing. I think I can see, oh, I've seen one case. And I remember, you know, looking at, that's it. Oh, that would be so nice if I could share it. Okay. All right. So I'm looking at my cases and I'm thinking, how do I make sense of these cases that the assessors can see and understand what I'm even saying? Because at the time, I'm like confused, you know. And back in the day, they would have these records from the College of Optometrists. I think it's actually the same records that the pre-regis are using now. And then you have to fill in all your record cases. Literally, I mean, right now you're filling in numbers. And then when you go into the interview hall, you will sort of verbally talk about the patients you've seen. But in my day, before you go into the exams, you actually have to present a logbook. I'm actually looking at one of my cases here. This is an aftercare record. And then you put a patient number, and then you've got all the things, the occupation, you know, the lifestyle questions, history and symptoms. This was an end of trial appointment. You know, you got the care readings, what type of lens was there, what solution, what was their previous contact lens history, the pattern of wear, care system, evaluation of the fit, visual acuity over refraction, you know, all these. But I remember looking at my cases at the time and thinking, how do I present this? Because it was a known thing at the time for you to submit your logbook and then it gets rejected. I'm thinking, no, it has to go in the right way. And I remember speaking to my mentor. I've always talked about this lovely lady, Dr. Mary Ann. I remember speaking to her and she told me exactly what to do. And what she told me to do, I did. And when I did it, I submitted my logbook and it was accepted first time, no case repeats. And so I say that to say to you, everything that I'm going to be sharing here is key. And if you follow what I'm going to share today, I'm going to feed on other days that I've taught as well. It's going to really help you. Before I continue, I want to know in the comments below, can you hear me? Yeah, can you hear me? Can you hear me? Watching from Abuja, Nigeria. Okay. Hi from Abuja, Nigeria. Can you hear me? I want to know. Awesome. Can you hear me? Can you hear me? Can you hear me? Hope I'm not rattling to myself. Well, I want to believe that if you can't hear me, you would have told me in the comments. I am not to go alone on this journey. Awesome. And then not to go along. Okay, am I saying yes, you can hear me? Thank you. Awesome, awesome. Great stuff. Now, let's get going. So today, I just want to show you the exact process to turn your overseas cases into a strong UK standard answers, because that's what you're doing in the hall. Okay, so we'll cover the UK competency framework, how your overseas cases differ, and the step-by-step conversion process. And then I'm just going to be using few examples just to run through. Okay, right. Now, remember key things that you need to remember, and I'm just going to give a foundation for those of us that are new listening to this sort of teaching. I even think that this will be an amazing podcast. Who knows? But remember, for the UK qualification process, everything you've been hearing me say, everything you've been hearing me talk about for the past 10 years, all expires September 2026. And so if you are watching this video or this program, this training, anytime September 2026, most likely, I don't know, but most likely what I'm talking about may not apply. But if you're watching it anytime before then no, there is only one way to become a UK qualified optometrist from the international community, and that's including Europe. As far as you qualified outside the United Kingdom and Switzerland, this is the only one route as of right now, up until August, September 2026. And that is, in a nutshell, application form. Okay? The GOC interview. All right? Then your pre-registration year, and at the end of the pre-registration year, you sit an exam, and then you are fully qualified. Coming into the UK to do a master's, whether it could even be a master's in clinical optometry, it does not take you closer to the consulting room than someone that is practicing, let's say in Abuja, Nigeria. Both of you are still on the same distance from the consulting room. I just wanted to make that clear. Now, secondly, if you've been following me for a long time or a little while, that I'm up for passing the GOC interview first time. Because when you pass your GOC interview first time, it's going to save you money, it's going to save you stress, it's going to save you time. And when I talk about money, it will save you on average £4,000. Time, on average, 6 to 12 months. Heartache, anxiety, and the rest, I don't have a gauge for that. So if you missed any of the training we've done, yesterday, so this is day 4, day 1, day 2, day 3, I would advise visit our YouTube channel, acnacademy.com. What am I talking about? Sorry, ACN Academy on YouTube, and then go through those teachings and other teachings there that will be really helpful for your journey. Okay, so just to recap, because we need to build on this. The GOC interview, like I've said, is a competency-based interview. Who can remember the 8 competencies? If you know anyone, just put it in the comments below. Let me know. I want to see it. I want to know that you're listening, you're taking notes. Let me know. Put it in the comments below if you know any one of the GOC competencies. There are only 8, not 9, not 10, just 8. I want to see, let me see who knows them. All right, number one, yeah, we've got communication. No, no. Professional conduct, yes. Then you've got communication. And then I'm going to say it in any order because I don't know. Professional conduct, communication, optical appliances, ocular examination, binocular vision, contact lenses, ocular diseases, vision, function. Yeah, those are the 8 competencies. Okay. And so when you're looking at your cases, you need to begin to group the cases that you see in all these competencies. You must know that when you are presenting your cases, the cases that you see in clinic, what the assessor is looking for is structure, is looking at your clinical reasoning, is looking at patient safety. Now, sometimes when we come across those that have done the interview and they will put upon and they would say, they may say, maybe I had a question on, say, tell me a case of a patient that you've seen that had cranial, let's say a patient that you had, in fact, just tell me a case of, let's say, wet AMD that you've seen. Or tell me about glaucoma. How do you manage glaucoma in your practice or things like that? And then the candidate may say, and I mentioned maybe like visual fields, and I said I was going to do like a 30-2, and then in bracket they will say, and the assessor began to grill me here. They were really grilling and they didn't want to go, and they kept asking. What they are doing at that point is they want to see your clinical reasoning. They want to see, and whilst they're asking you those grilling questions, they're also making sure that all the indications under the glaucoma subsection, under ocular diseases, that you're able to tick all those indications. Okay? So, now, when you are preparing for the GOC interview, you must know that we all know in the international community that there are common differences in the way cases are seen and handled in different countries. And actually, in the United Kingdom, we have like I've worked under 2 glaucoma consultants, and both of those 2 glaucoma consultants, even though they are working in the same hospital, in the same CCG, and that simply means the same, medical area, both of them have a different approach on how they see patients. And so while I was working with the one I worked with, that was my mentor when I was doing my independent prescribing, I worked with his system. Now he's left. I'm now an independent prescriber and I run independent clinics in the NHS hospital. But then now we have a new chief. So he says, this is the way I want you to report. This is the way I want my patients being seen. I am following that way. So going into the interview and ignoring your own heritage and the type of unique cases you see in your practice does not do you well. Actually, the assessors will be pretty excited to hear, those things you have to say about the narrative you have about your clinic, your cases, the way cases are handled. Okay. So, yes, you're going to accept and present the narrative of, the uniqueness of cases that you see in your practice. However, you're still going to have to present them in the right structure. The structure matters quite a lot. Okay. So just be reassured that your years, I recently put out, I'm doing some what am I doing? I'm doing a 5-day GOC success challenge. It's a one-on-one. I'm working, just going to work with some people. I've got few people starting this weekend, and when I'm looking at the things that they're doing and the concerns that they have, a lot of people are saying that I don't know that I've got the right experience. I don't even know how to maybe fill in the application form, because what I have in my head regarding my patient data doesn't really fall into these lines and these numbers they're talking about. I don't know. But I want you to know that your experience in your clinic right now is very valid. The UK system knows that it's valid. And that's why they've called you in. That's why the borders are open for you to come in. We in the United Kingdom, yeah, till tomorrow, we need optometrists, and they know that you've got the skill. But they also have to go through that rigorous application process to make sure they allow the right people in. Now, you could be the right person by structuring your answers pretty well. Okay? Structure your answers pretty well. But before I go there, I just wanted to say to you, your cases are very valid. Your experience is valid. Your experience is a good foundation, a good starting point. But I don't advise any international optometrist to walk into the interview just by the experience you have, because what needs to happen is a little bit of tweaking. Yeah. A little bit of reframing, structuring, structuring. One thing I notice a lot with um and that includes myself. When you're seeing a patient in clinic, you're just seeing them. You're just seeing them. You're seeing them on autopilot. You know what to do. You know how the equipment works. You know the next steps you're doing. But so for some people, if they are to sit down and explain what they're doing to that patient, they can't. But that's a skill that you need to pick up for the GOC interview in order to turn your international cases into UK standard answers that will make sense for the assessor. You need to bring in structure. Is that making sense? Yeah? Is that making sense? Good. Now, another thing that I would advise that you do is you want to, okay, let's just go through the framework of turning your international cases into a UK standard ready answer. Number one, identify the overarching competency. Okay. Number two, check for the indicators. So immediately when you submit your form, the GOC actually tells you what to do. For anyone that has submitted their form, go and read the email you get back for your interview. What does it say? It says, go over your application form. And people read that and they don't understand. What they're saying to you is, in the application form, you have your overarching competencies. And in the overarching competencies, you have the indicators, everything that you need to know inside that competency. That's what you need to do. Once you're asked a question, yeah, I'm getting into the framework now. You need to, what are they asking me? Flashes and floaters. Okay, where does this fall? Ocular diseases. Where does this fall? Subsection retinal detachment. Yeah? You now begin to think, what are all the indications in that particular bundle, if I'll use that word? And then you are then going to reframe it and then present a very structured answer. You are going to talk about your local protocols, and a clever student would always say to them, but I know in the United Kingdom, this is what is obtainable. Okay. One tip I'll give you here is, if it is a lens that you're going to talk about, a coating that you're going to talk about, a medication that you're going to talk about, do not use trade names. Make sure you're using for drugs active ingredient. Make sure you're using for the lens type, the frame type, the anything you're talking about. Let it be universal. You don't want the assessors to begin to think, what on earth is she talking about? No, it has to be in plain language. Okay. And then you just show your reasoning. Okay. Show your reasoning. Know your boundaries when you're discussing cases. So obviously in the academy, I teach, the site test module, and we have what we call the phases. So when you are preparing to go through your interview, you want to think about presenting your cases in phases. Phase one, what happens in phase one? This is the all about the me gathering information from my patient. What happens in phase two? From the information I've gathered, these are the tests that I conducted or I will conduct. And then from the results of that, this phase three, these are my differential diagnosis, tentative diagnosis, absolute diagnosis, or differential diagnosis. And then you move to the final phase four. What is the management plan for this patient? And so a lot of people go into the interview hall and they begin to waffle. Do you know why they're waffling? It's just all over the place, no structure. You need to come up with a structure. And if you've listened to me in a minute, you know that I talk about the STAR method of presenting, sorry, of presenting your cases. STAR method. What's the situation? What task did I have? What is the action? What is the result? That's how you present your cases. Okay? Awesome. Now, sometimes you actually even want to fish out cases from your arsenal that have different, maybe referral criteria to that of the UK. Because in that little 45 minutes, 50 minutes, you're in there with the assessor, it is your opportunity to sell yourself. No, I'm not saying you're selling your soul, but you have to sell yourself to the assessors and tell them, I'm the girl, I'm the man. I am the person that you need in your consulting rooms, seeing your patients. Yes, I am the one that's going to make sure that clinics are not cancelled because they don't have an optom. I am the one because I've got the experience, I've got the skill, I'm confident about what I'm saying, and I have the competence that you're looking for. Okay, awesome. How is that going for us so far? We getting are we getting any value from the teaching this um evening? All right. So now I always say that a very simple one, a very simple demonstration about talking about your cases in your and the way you handle your cases in your country and in the UK would be leveraging any case that needs to be referred. And I say that because in the UK, we have what we call the NHS, the National Health System. And that means that every single person, if they need an operation like a cataract surgery, a lid surgery, or, any of those routine eye surgeries, then we refer them into the hospital and they could be seen 18 months, 18 weeks, 6 months, a year. Whereas if that client maybe has private health insurance, they would go and be seen straight away. Now, if I was in the interview today, what I would do is if I had any particular case that needed to be referred, I will use it and shine. So after presenting my case, I would then say I would refer to the ophthalmologist. And the good thing about my country, Nigeria, is that if you need cataract surgery, you need lid surgery, corneal surgery, any of those called, routine surgeries, you can get them literally next day or on the day according to the time, because everybody pays for their treatment. However, I am aware in the United Kingdom that there is a referral criteria, especially for those that do not have maybe private insurance, they're not going privately. Then if it's a cataract, obviously most times that's going to be a routine referral. So I'll write a routine referral and send them to the hospital, give them advice on, UV protection. If they're not up to driving standards, I would advise them not. Do you get what I mean? You see how you structured that to showcase that you are not just coming from the international community, but you have already begun to adjust your practice with UK in mind. And that gives you a big thumbs up from the assessors. Okay, right. So that's what we have for today. A quick recap of the main points. Your overseas cases, definitely not a disadvantage. I hear a lot of moaning and groaning and moaning. And I say, darling, you need to be grateful. What am I saying? In my life, when I came here, I was moaning and groaning. What type of degree is this? I can't even use it. I have to be a healthcare assistant. I have to be, just selling on the shop floor. But that was the same foundation that I built upon, and where I am today. So where you are is fine. Your overseas cases is not a disadvantage. They are your strength, and once structured correctly, amazing. Okay. And so I'm just going to invite you into ACN Academy if you want to practice this process on your cases, ensure that you've got structured answers. And I can hear somebody say, well, you can only structure your answers if you know what you're saying. Well, in ACN Academy, our accelerator program, we've got you covered. So we work through everything from your documentation to going through tutorials and everything in between, structuring your cases, working on you with confidence. And even if English is not your first language, but you need to know how to speak English though. Well, you can't do it without the English exam anyway. So as far as you've got your speaking 7, you're good to go. You are definitely good to go. So we work with you on all that. And at the end of our program, you literally come out a UK ready optometrist. If that is of any interest to you, you can comment accelerator below and or just DM me, and then I will arrange a meeting and we can get you started. Our cohort 5 is starting on October 5th, and I am inviting you to join that. Right. Tomorrow will be the last day of our 5-day marathon live training. Whoop, whoop. Somebody show me some love then. Come on then. Show me some love. Oh, come on. Optometry is fun. It mustn't always be really strict. Lens 1, lens 2. Da, da, da. You have to have fun. And tomorrow we'll be tackling your 4 top worries: time, money, visa, jobs. And so if you're interested in any of those topics, come out tomorrow, ask questions, let's interact, let's have fun. I'm just going to check to see if I have any questions. No questions. Awesome. Right stuff. Okay. So I want to thank all of you for being here. Emma, thank you for coming out. Nehemiah, Marcus, nice to see you all. I want to say a big thank you. If you are interested, or you are ready, or you are thinking of qualifying between now and June next year, you want to pop in and join the accelerator program in ACN Academy starting the 5th. Some people have already started, and what we're doing right now is sorting out application form, documentation, booking IELTS, getting that out of the way, ready to go deep dive into all the competencies, all the indications, getting ourselves ready to become that UK ready qualified optometrist. Okay, it's been an amazing time. Thank you so much for watching. Before you clock out right now, go ahead and like the stream, say something in the comments, show some love, and I'll see you tomorrow afternoon on TikTok and in the evening right here 7:30. I say big God bless, and I wish all of you success. As many of you that have got your interview dates, I wish you all success as you go through. I wish you all success when it gets to your turn. Big God bless. You take care now. Bye.